It's early May, and a lot of people, there's been a lot of sneezing, a lot of watery eyes lately, all due to the increasing pollen levels. We spoke to a local allergist to learn more about allergy season for the spring of 2024. Okay, since about the beginning of spring, it seems like we have been hearing a lot about, or maybe seeing people dealing with some more allergy symptoms out there. It's that time of year, and standing by, we have Dr. Tony Orden of the Allergy Asthma Medical Group, centered in the East Bay, and he has some information with us to share with us. Thanks for joining us today, Dr. Tony.
Thank you.
Could can you describe lately? Has there been a noticeable uptick with people coming in complaining of allergy symptoms?
Yes, absolutely. I would say, especially over the last month, there has been a large number of people coming in with sort of classic allergy symptoms: itchy, watery eyes, runny nose, sneezing. I have seen a lot of those patients in clinic.
And is it basically what you'd expect this time of year, every year?
Yeah, every year around this time of year, there are a lot of tree pollens earlier in the spring, but over the last few weeks, grass pollens have also started to come out. So many patients are suffering who are sensitive to those spring allergens.
And is there anything different what you're noticing about this year, spring of 2024?
Yeah, it seems like symptoms are a bit more severe this year. I think that people who maybe had some low-grade manageable symptoms were experiencing them a bit more severely this year, and maybe people who thought they didn't really have severe allergy symptoms may have been experiencing it for the first time. I think the weather has a lot to do with it. We received quite a bit of rain, and so a lot of the plants are releasing a lot of their pollens, and we're getting a mix of a lot of different pollens that are in the air, exposing people with allergies. And people with allergies, they tend to be allergic to a lot of pollens, not just one.
And dealing with this in the past years, how long do you expect this to continue? Next couple months, something like that?
Yeah, so generally speaking, especially here in the Bay Area, the tree and grass pollens will continue to go until about the end of June, early July. So usually I roughly tell patients to look for a bit of reprieve sometime around the 4th of July, late June.
And I've had some episodes myself, and I've never the thoughts never really crossed my mind to go into the office. What when should people go see a doctor like yourself?
I think once you've sort of tried, there's some over-the-counter remedies that you can try that are quite effective. There are antihistamines that you can try. Also, some nose sprays, nasal steroids, and nasal antihistamines that are available over the counter. There are also eye drops that you can try over the counter. But if you are finding that you're not getting quite the relief that you're looking for with those, it definitely is important to either start with your primary care doctor or come see an allergist. We can help you find out exactly what is that you're allergic to, and then offer therapies that might be a bit more directed to the allergies that you have. I think also it's important, especially for those people who have asthma, to come in and see a specialist if the allergens are precipitating a lot of breathing symptoms.
Okay, great point. Another question, I think it was maybe a few weeks ago, I was in a rough spell with allergies, and you go to the store and you're bombarded with so many different options out there. Do you recommend a pill or a nasal spray? Is one better to treat, like if you just need something right away?
Yeah, it's a really good question. I mean, I often tell people it's like a headache. When you go and you look for a pain reliever, you'll find either Advil, Aleve, those sorts of things. And I think generally speaking, it's sometimes hard to predict which one any one particular person would respond best to. They're all pretty much in the same same class. But there are some antihistamines that you can get over the counter. There are some that are compounded with pseudoephedrine or Sudafed, which you sign for usually at the pharmacy. You don't need a prescription for it, but because of the Sudafed component, those used as needed can also be helpful. But it is important to check with your doctor as well before starting these medications, in case there's any kind of adverse reaction or interaction with other medicines or medical conditions that you might have.
And visually, do you look around the environment and see, like, some visual cues of what's happening? Obviously, we could see, pollen going around sometimes, but just the hillsides, are you looking at that, like, just to give you just a general idea of what's happening on that day?
Yeah. Yeah, absolutely. I mean, I think it's probably more of a change that happens more gradually than sort of day to day. I think day to day, you can notice the pollens that have deposited on the cars and on the windows. In the hills, you'll see that the grass lengths, the heights are, starting to get a lot higher. And then, one sign that the allergy season is kind of getting closer to an end, not only timing wise, but if you notice the hills starting to turn brown, we're starting to get to that point where the allergen levels are probably starting to dissipate a bit.
Okay, so in the short term, it could still be a little bit of a challenge to get outside if you're sneezing and all that. But you're saying maybe by 4th of July we could have some improvement out there, right?
Yeah, hopefully. And if there are a lot of remedies out there and a lot of ways to feel comfortable, if you sort of need that, to get you there to the 4th of July.
Yeah. Okay. Well, thank you so much for your time today. We really appreciate your help and all the information you provided.
No problem. Thanks for having me. Good to talk to you.
Good to talk to you.